So we're going to start today with doing taping for shin splints. This is a common injury that quite a few runners get, especially when they're competing on the track surfaces, just because a lot of pounding that's going on. And it can take a whole number of different forms. You can have pain in the muscle up high, you can have it down low, you can have it directly right on the front. Probably though the most common is going to be on the medial side, especially right as you feel on the medial border, right between the kind of the muscle belly of the posterior tibialis tendon and the medial tibia. So those are typical common places that we're going to get. So what we're trying to do is we're trying to apply pressure onto the tape so that way it actually kind of pulls the muscle belly in towards the bone. That way it's not separating as much, and that's one of the major problems with shin splints is that it's like this tearing action. So you have all these repetitive microtraumas on either the inside or the outside. So we're trying to kind of bring in that muscle belly in just a little bit so that way it doesn't pull off so much. It's not always super effective, but it's one of the very few tape jobs that we do have that has been known to help with shin splints, so we typically will try it and see if that actually will help. So first thing we're going to do is we want to have them, again, clean and shaven. This is extremely important for this tape because the only way that this is going to work is to really go directly onto the skin. Make sure that you're spraying using tough skin spray. Just to make sure that it secures directly onto the skin. Now for today, just because he's not clean shaven, I'm going to use a little bit of Power Flex to go over the top of it. Sometimes what I have done in the past is because this Power Flex is actually holds pretty well to the skin. Some individuals have some issues with the adhesive of the tape. So if you try to do this shin splint taping, it just irritates them like crazy. And so what I'll do is I'll tough skin them and I'll put the Power Flex down, and it does hold pretty good onto the skin. So it could be an alternative that allows you to actually be able to do this. Okay. So what I will do is I will place a longitudinal strip on the lateral side and a longitudinal strip on the medial side. Now, there's different techniques with this. I'll kind of explain some of the differences, and then I'll show you or kind of explain why I do it a certain way. So I'm going to do a longitudinal strip on the lateral side, a longitudinal strip on the medial side. Now, the theory here is that you kind of have to ask them where actually the injury is. Is the pain on the lateral side, which is probably going to be more a problem with anterior tibialis, or is the pain going to be on the medial side, which is more posterior tibialis? So that will dictate which muscle we're actually going to pull together. So we'll be pulling together the anterior tib, or we're going to pull together the posterior tib. Most of the time it's the posterior tib that's causing our biggest problems. Okay? Some people actually, instead of placing their longitudinal strip way to the lateral side, they actually go right down in the center and then they just kind of pull together here. I feel like if I'm going to get a pull, I want it to come actually all the way around. So that way the anchor is way over on this side instead of just trying to go a very short distance, because I just don't feel like that's going to get as much of a pull as I'm really looking for. So you'll see it different ways, but this is generally speaking the way that I like to do it. So what we're going to do is we're going to anchor onto the posterior tib side. So we're going to place that down on our anchor, and then what we're going to do is we're going to hold it so it's secure, and we're pulling about as tight as we can all the way across, and then securing it to that lateral side. Okay. Now, I can pull it as tight as I want because I'm not wrapping it all the way around. So what I'm trying to do is I'm trying to pull in and anchor that over as much as we possibly can to this other side. Again, trying as much as we can to pull that posterior and bring that posterior tib tendon closer to the bone, closer to the tibia, so it's not creating as much pulling away from the bone and pain issues as possible. Plus, I think another thing about this tape that actually helps is just the compression onto the tissue that many times helps it. So I don't know if mechanically if it helps by the pulling, or if it's just the pressure that goes straight down onto it that is super helpful. So we're getting close to the top here. Okay. Now you could, if you wanted to, do it again. You could come back a little bit further, so that way you kind of double it up. But here we're just going to stay with singulars here. Now obviously this has the possibility of kind of popping off here. So what we're actually going to do is we're going to take one more piece, a longitudinal piece, and go right over the top. Okay. Rub that, heat activate that so that adhesive gets nice and firm and tight on here. Put another longitudinal strip on this side, kind of rubbing that down. Okay. Now at this point in time, you could send them on their way, but after they sweat quite a bit, there's a pretty good chance that this is actually going to pull off. So one of the things that we'll do is we'll take now our adhesive elastic tape. We're actually just going to wrap all the way around, which just allows the tape on the leg here to stay. That way, if it doesn't really matter what sport they're in, if they're a soccer player, if they're a football player, and they're running around, they're sliding in the dirt, that's going to stay nice and secure. Just place a couple pieces of tape just to make sure that the adhesive tape doesn't pop up. Okay. And there we go. Okay. Ask them how it feels. Check for circulation, capillary refill. Check the distal pulse. Make sure that we haven't done anything too terribly tight. One thing, a couple concerns with this particular tape. You want to make sure that many times shin splints has very similar symptoms to stress fractures. So you don't want to just try to do this tape and not really be thinking about a stress fracture. So make sure that you see if it's the pounding that causes the pain. Is it painful in one particular spot right on the bone, or is it more along that ridge where you see more of the shin splits? Another situation is compartment syndrome. Compartment syndrome is where the muscle on the inside is actually bulging because it's getting too much fluid built up into it, that it's cutting off the space for the arteries and nerves. So if you put this tape on, that you're actually exacerbating that condition. So you want to tell them, if it gets worse by having this on, you need to tell me because we got to get it off. So if it gets better, fantastic. But if it gets worse, you got to get it off right away.